Iron deficiency anemia leads to pallor, fatigue, dizziness, exertional dyspnea, and other symptoms of tissue ischemia. A. True. B. False. Which drug does not influence leukopoiesis? A. Filgrastim. B. Erythropoietin. C. Doxorubicin. D. Methotrexate. B. Erythropoietin. All of the following drugs used for iron deficiency anemia except A. Ferrous sulfate. B. Folic acid. C. Ferrous gluconate. D. Ferrous fumarate. B. Folic acid. An adverse effect of oral iron therapy is A. Anemia. B. Thrombocytopenia. C. Headache. D. Constipation. D. Constipation. Select the drug of granulocyte colony stimulating factor. A. Filgrastim. B. Methotrexate. C. Erythropoietin. D. Doxorubicin. A. Filgrastim. Following drugs stimulate erythrogenesis except A. Iron dextran. B. Vitamin B12. C. Methotrexate. D. Folic acid. C. Methotrexate. Recombinant human erythropoietin is indicated for A. Megaloblastic anemia. B. Hemolytic anemia. C. Anemia in patients of thalassemia. D. Anemia in chronic renal failure patients. D. Anemia in chronic renal failure patients. Which is an appropriate treatment for a nutritional anemia that presents as a hunger for ice and or upward curvature of the fingernails? A. Vitamin D. B. Vitamin B12. C. Folate. D. Iron. D. Iron. Which drug would be beneficial to reduce the frequency of painful crisis in a patient with sickle cell disease? A. Apotin alpha. B. Filgrastim. C. Hydroxyurea. D. Sargramostim. C. Hydroxyurea. TF. Anemic patients with chronic kidney disease cannot benefit from EPO therapy. False. TF. The central stage for hematopoietic machinery is the bone marrow. True. There are 3 essential nutrients necessary for hematopoietic systems. Select all that apply. A. Folate. B. Iron. C. Vitamin C. D. Vitamin B12. E. Vitamin B6. A. Folate. B. Iron. D. Vitamin B12. Which of the following drug cannot be used for iron deficiency anemia? A. Ferrous sulfate. B. Ferrous gluconate. C. Folic acid. D. Ferrous fumarate. C. Folic acid. A 56-year-old woman is discovered to have megaloblastic anemia. Her past medical history is significant for alcoholism. Which would be the best treatment option for this patient? A. Oral vitamin B12. B. Parenteral vitamin B12. C. Oral folic acid. D. Oral vitamin B12 with oral folic acid. D. Oral vitamin B12 with oral folic acid. Bacteria. Spheres to rods and spirals. DNA not nuclease bound, single loop. Infection. By cough or sneezing, eyes, nose, mouth or open cuts attack and multiply. Good bacteria keeps balance. Bad bacteria cause disease. Hans Christian Joachim Gram, Danish bacteriologist. Gram-positive bacteria. Gram-positive bacteria. Thick marine mycobacteria. Central dogma 2 steps. Transcription and translation. DNA greater than RNA greater than protein. Topoisomerase. DNA replication. RNA polymerase. RNA transcription. Ribosomes. Protein translation. Drug treatment interrupt bacterial focus on DNA replication transcription translation. Crick, Watson and Morris Wilkins awarded Nobel Prize for DNA double helix. DNA nucleotide. Phosphate group sugar deoxyribose or ribose nitrogenous base AGCT. Complementary rule. DNA two long strands ATCG form rings and letters. Bacterial chromosomes are eukaryotic chromosomes are circular linear. DNA replication, segregation and topoisomerases. DNA double helix must unwind and separate. Topoisomerase deeper functions. 1. Remove excess DNA supercoils during replication. 2. Separate interwin progeny DNA by breaking 3. Rotate and relegating DNA strands. Topoisomerase type I. Form and reseal single-stranded. Topoisomerase type 2. Nuclease and ligase both strands DNA remove excess and permit segregation DNA to daughter cells. Why is replication necessary? So both new cells will have the correct DNA. When does replication occur? During interphase S phase. How replication work? Enzymes unzip DNA and complementary nucleotides join each original strand. Bacteria transcription. 1. Initiation. 2. Elongation. 3. Termination. RNA polymerase act as selective target for antibacterial drug action. Rifampin blocks elongation by complexing with beta subunit of RNA polymerase. Bacteria protein synthesis. 30 subunit contains 16 rRNA and 21 proteins. 50 subunit contains 2 rRNA molecules, 23s and 5s rRNA and more than 30 proteins. rRNA responsible for ribosome key activities, not proteins. Translation. Cell uses information from messenger RNA to produce proteins. Translation initiation. mRNA joins 30s and tRNA link to FMET. FMET rRNA bind to OG50s join 30s to form 70s ribosome. FMET rRNA occupy P site of 70s ribosome. Translation elongation. Peptidyltransferase 23's rRNA of 50s subunit translocation A site to P site termination A site meets stop codon. Antibiotics inhibit translation and inhibit activity of 16's rRNA. Aminoglycosides, spectinomycin, tetracyclines. Antibiotics inhibit translation bind and inhibit activity of 23's rRNA and 50's subunit. Macrolides, chloramphenicol, lincosamides, streptochromins, oxazolidines, pleuromethylanes. Drugs target bacteria replication. Bacteria structure. Peptidoglycan, cell wall. Drugs target bacteria replication. DNA replication. DNA helicase, DNA polymerase, topoisomerase IN2, DNA gyrase N4, DNA ligase, trimase. Drugs target bacteria replication. Transcription. RNA polymerase, initiation, elongation, termination. Drugs target bacteria replication. Translation. Initiation, elongation, termination. Why is transcription necessary? Transcription makes messenger RNA mRNA to carry code for proteins. Describe transcription. RNA polymerase binds to DNA, separates strands and uses one strand as template to assemble mRNA. Why translation necessary? Translation assures that the right amino acid are joined together by peptide to form the correct protein. Describe translation. Cell uses information from mRNA to produce proteins. Main differences between DNA and RNA. DNA has deoxyribose, RNA has ribose, DNA has 2 strands and RNA has 1, DNA has thymine, RNA has uracil. Bacterial cell wall divided into 3 major stages. 1. In the cytoplasmic phase of marine monomer synthesis. 2. Polymerization stage. 3. Cell wall biosynthesis. Polymers cross-linked in reaction catalyzed by bacterial transpeptidases TPs. Transpeptidase catalyzed transpeptidation reaction occurs in bacteria, not mammalian cells. Bacterial pathogenicity. Ability of bacteria to cause disease and is expressed in terms of virulence. Fimbrate flagellotoxins. Invasion. Salmonella destroy intestinal cells, cause diarrhea TB. Bacterial pathogenicity. Infection. Contact, inhalation, ingestion, inoculation, SUBQ, congenital adhesion, invasiveness, toxigenicity. Endotoxins and exotoxins. Exo are most poisonous substance. Bacterial pathogenicity. Other factors causing infection. Bacteriophages, plasmid surface antigens, drug resistance. Alexander Fleming. Penicillium. Drugs that target marine. Vancomycin, telavincin, ticapenin. Beta-lactam antibiotics. Penicillin, cephalosporins, monobactams, carbapenems inhibit transpeptidase enzymes. Backbone differ from one another. R groups differ. Drugs targeting bacterial topoisomerases and transcription. Quinolones, nalidixic acid, cipro inhibit topo I. Rifampin and rifampicin inhibit DNA-dependent RNA polymerase aminoglycosides. Streptomycin and gentamicin, tetracycline and doxycyclines. Drugs mediate RNA and protein synthesis. Inhibitors of cells wall synthesis. Phosphomycin, cycloserine, vancomycin, penicillin, cephalosporins. Drugs mediate RNA and protein synthesis. Inhibitors of DNA synthesis and integrity. Quinolones. Drugs mediate RNA and protein synthesis. Inhibitors of transcription and translation. Macrolides, tetracycline, spectinomycin, aminoglycoside. Aminoglycoside molecule or a portion of a molecule composed of amino-modified sugars. Antibacteria, amikacin, arbacacin, gentamicin, kanamycin, neomycin, nettlemycin, paromomycin, streptomycin, tobramycin, apramycin. Drug resistance. 1. Developing new beta-lactam agents. 2. Co-administering beta-lactam decoys. Antibiotics, bacteriostatic and bactericidal antibiotics. Bacteriostatic inhibit bacteria from reproducing but doesn't kill them. Bactericidal antibiotics kill bacteria. Antibiotics, major mechanism of antibiotics. Cell wall synthesis, nucleic acid synthesis, protein synthesis. Antibiotics, common classes of antibiotics. beta-lactams, penicillins, cephalosporins, carbapenems, monobactams, quinolones, bactericidal, monoglycosides, bactericidal, sulfanilamide, sulfonamide, antibacterial functional group PABA4, folic acid, coenzyme furosemide, loop sulfadiazine printosial, cell wall, B-lactams, penicillins, protein synthesis, 30s inhibitors, aminoglycosides, tetracyclines, tioxycline, 50s inhibitors, clindamycin, macrolides, membrane integrity, polymycin, beta-daptomycin, nucleic acid synthesis, fluoroquinolones, metronidazole, rifamycins, metabolic pathways, sulfonamides, trimethoprim, antibacterial drugs target cell wall through 1. Synthesis, marine monomers, phosphomycin and cycloserine. 2. Polymerization, vancomycin, ticopenin. 3. Cross-link, beta-lactams, penicillins, cephalosporins, monobactams, carbapenems, bactericidal. Target 1. DNA replication. 2. Transcription. 3. Protein translation. 1. Quinolones. 2. Rifamycin. 3. Aminoglycosides, tetracyclines, chloramphenicol. Gram-negative bacteria, thinner marine LPS mycobacteria, pharmacogenetic variations, drug target receptor, transmembrane enzymes, intracellular ion channels, transmembrane metabolizing enzymes, endogenous transporters, uptake, absorb, efflux, eliminate, polymorphism, transporter, clinically significant indication. Drugs targets, polymorphism and drug effect, drug efficacy, genetic variations, differences in response to therapeutic agents, type of target, polymorphism, effects on dose, choice of agent depend on population target. Drug target receptors, ADRB1, beta-1 adrenergic receptor, gene antagonist, hypertension, 2-SNP and ADRB1, SIR49 GlyArg389 Gly is a variant SIR-Arg homozygous, greater blood pressure reduction, metoprolol, carrier of glybad, polymorphism. SIR49 Gly. Downregulation, low number of receptor, beta blocker, DOESNT helps since there are already few receptors. ARG389 Gly. ARG389 higher basal and adenyl silase activity, Gly low basal adenyl activity, so beta blockers can help blocking receptor DOESNT, improve for people expressing Gly. Drug target enzymes, VKOR, vitamin K epoxide reductase, target warfarin, oral gene encodes VKOR, VKORC1 equals polymorphism and responsible for CYP2C9 polymorphism. Group A, low dose, Group B, high dose. Drug dose change based on population. The higher the VKOR level, 1 increased dose, 2 decreased dose. 1 increased dose, high dose of warfarin to block molecule. Hispanics and AA have need higher doses. Drug target ions channels, gene KCNMB1 codes for large conductance, calcium and voltage gated potassium channel equals 2-SNP glue 65 lights thou 110 loop polymorphism good makes patient more responsive. CCBs, verapamil, faster control of BP with lice, lower risk of cardiovascular during verapamil with FAL. Metabolizing enzymes, CYP450 enzymes, G6PD, NAT-CPMTDPD at first FDA testing, responsible for death in certain patients. Metabolizing enzymes, CYP450 enzymes, 1A2 carcinogen induced by smoking. 2A6 procarcinogens need bioactivation. Nicotine, naproxen, 20% Asian poor metabolizers pro but not carcinogenic. 2B6 metabolized non-nucleoside reverse transcriptase inhibitor. Efavirenz old HIV drug. Cyclophosphamide. Bupropion. 2B6 causes toxicity. Metabolizing enzymes. CYP450 enzymes. More C. 2C8 metabolized tricyclic antidepressant diazepam. Verapamil. 2C9 metabolized warfarin dosed by drug target and enzyme phenytoin NSAIDs. Fluoxetine. 2C19 metabolized PPI TCAs. Clopidogrel prodrug and polymorphic antiepileptics. 13 to 23 Asians. CYP450 enzymes. 2D6 metabolizes 21% clinically important drugs by themselves. Significant metabolic reaction. Barely other CYP overlaps. Metabolizing enzymes. G6PD oxidative drugs. G6PD glucose 6-phosphate dehydrogenase exposure to oxidate drugs. Aspiring sulfonamides, nitrofuration, dapsone, primacaine, quinidine, favabeans. Infection limited RBC replaced. Avoid oxidative drugs. G6PD metabolizing enzymes. NET2 metabolizing enzymes. TPMT TMPT thiopurine S-methyltransferase metabolizes thiopurine. Active drugs like mercaptopurine and azathioprine. Inactive immunosuppressant. Rheumatoid arthritis. Gout. Anti-cancer. Highly polymorphic. Low versus high TPMT. Metabolizing enzymes. DPD DPD diagrams. High risk. Toxic with chemo drugs. Severe deficiency. Seizures. Small head. Autism. Motor disability. Accumulation of nitrogen compounds. Thymine. Uracil. Affect metabolism and hormonal development in both. Polymorphism of base pairs. Metabolizing enzymes. UDP endogenous transporters. Uptake. OAT organic anion transporter and intestine. Hepatocytes, kidneys. BBB better absorption. SLC1B1 gene encodes for OAT uptake of statins as SNP equals decreasing function of OATPB1. Grapefruit juice inhibit intestine transporter. Affect TPK drug. OAT structure of statins. Rhabdomyolysis risclova SIMB predator fluvis rosu. Lipophilic longer chain statin. Atorvastatin. Lipophilic statins. Carboxylic anion. Rosuvastatin. In order for statins to be active, they need to have the green acid carboxylic metabolic ring anion. Lipophilic statin depend entirely in OAT. CYP3A4 statins absorbed in bloodstream. Blocked OAT1B1. Decreased hepatic uptake when block OAT roam in bloodstream equals toxic. Increased blood concentration. Liver is the site. MOA and metabolism of statin uptake pathway affect PKPD. Endogenous transporter uptake. Polymorphism of OATP1B1 increased statin myopathy lead to rhabdoprotein in blood equals toxic more in hydrophilic statins than lipophilic. Endogenous transporter efflux. Liver, kidney and GI common entry protect brain and placenta barrier to clear chemicals from body. Transporter has polymorphism. PGP localization. Intestine absorption, liver elimination, BBB distribution, but efflux, kidney excretion. Polymorphism expression, transformer expressed throughout the body affecting drug therapy. Antiepileptic drugs. PGP inhibits effect serum concentration of drugs leading to unwanted effects. More efflux, large hydrophobic cationic Zwitter ion molecules are substrates for PGP transporter. Bulky sometimes. Affect serum concentration. Serious side effects, digoxin, cardiovascular distribution, doxorubicin, loperamide. No BBB inhibiting PGP could cause high effects. Opioid analog, antidiarrhea, phenytoin. Old antiepileptic distribution affected by highly expressing PGP. Paclitaxel. Anti-cancer PGP substrate, drug resistance. Pentobarbital. PGP substrate adjust dose brain action. Polymorphism results in or PGP expression. Increase PGP expression. Relationship between ABCB1 and plasma. Digoxin concentrations, ABCB1 effect on distribution of antiepileptic drugs to brain. Increased ABCB1 expression limit ability of antiepileptic agent to penetrate BBB. ABCB1 block antiepileptics. BBB. Pharmacogenetic variations. 1 drug target, 2 metabolizing enzyme, 3 endogenous transporters. 1. Polymorphism receptor ADRD beta antagonist enzyme warfarin ion channels, co-channels and blockers. 2. DPD, TPMT, G6PD, NET, UD, CYP450. Drug TP drug to protein effect absorption. PK. Physicochemical properties, ionizations. Based, acid base, nature, telephone, urine, telephone equals faster elimination without reabsorption like phenytoin effect, solubility, absorption, elimination. Physicochemical properties, intermolecular forces. Based, functional groups, H bonding effect, solubility, plasma protein binding, distribution and absorption. Physicochemical properties, molecular weight. Based, chemical structure effects, solubility, absorption. pH effects. Oral doses changes affect solubility of drugs. GI affect ionization, drug state antacids change pH. GI and changes drug absorption. Mixing acid and base compounds equals precipitation of drugs. Salt formation causes the precipitation equals dissociation. pH affects bioavailability. pH changes affect bioavailability and absorption by decreasing solubility, unable to get enough drug into system. Antacids decrease therapeutic effects of drugs. Tums, Alka-Seltzer, Maalox, Malantol decrease absorptions. Na, Ka, Al. pH effect itraconazole. Not taken with antacids, increase gastric pH, decreasing drug solubility. Cation-anion interactions. Weak acid plus weak base equals salt equals pore dissociation. Not soluble solubility depends also on molecular WT. Not mix acid base in 4 bag equals insoluble salt equals precipitation. Cation-anion interactions. Case study 4. Do not mix weak acid and weak base. Chelation. Organic molecules with metals iron, calcium, mercury, magnesium decrease H2O solubility EDT component in blood drawn tuber to avoid clotting. Chelate large in mole size, poor solubility, poor absorption and decreased bioavailability. Chelation iron and antacids. Iron and quinolones antibiotics Cipro, tetracyclines Doxy and Vibra thyroid hormones. No apple juice equals zinc interact with gelatin drugs antacids multivitamin supplements no quinolones antibiotic or tetracyclines or thyroid hormones causes direct effect. What medication should be avoided to take with metal cation food or drugs? Quinolone and tetracycline antibiotics and thyroid hormones. Quinolones antibiotics. Ciprofloxacin, levofloxacin, moxifloxacin. Tetracyclines antibiotics. Tetracycline, vibramycin, doxycycline, minocycline. Ion exchange. Manage hyperlipoproteinemia. Low fat IE binds to bile acid in GI, preventing reabsorption. Decrease absorption by forming large complexes. Separate doses 3 to 4 hours. Colsivlem, Welchol. Drugs affected amiodarone contraceptives NSAIDs. Prevestatin not with liver combo forms big complex. Protein binding. Electrostatic interactions NH3, NH2, COO most frequent and stronger, bind to negative charge at physiological pH. Major plasma protein albumin increase binding with increased lipophilicity. Protein binding 2. Fungus. Eukaryotic cell wall chitin cell membrane ergosterol include yeast and mold. Yeast. Euca is sexual grape sugar into alcohol. Candida albicans can build up due to frequent antibiotic use that kill bacteria that keeps yeast under control. Gryzivulvin. Blocks mitotic spindle attack cell wall chitin. Beta-1,3-glucan. Integral part of the fungal cell wall linked together form structure. Balanced tolerance is the key to health. Constantly changes as aging occurs. Diseases originate from imbalance. Common fungal diseases. Aspergillosis, weak immune, candidiasis, coccidioidomycosis, valley fever, low rain area, fungal eye injury, PCP, pneumocystis, ringworm, skin infection. Ergosterol synthesis. Acetyl greater than squalene greater than linesterol greater than ergosterol. Enzyme and drug between squalene and linesterol. Squalene epoxidase allylamines benzylamines. Enzyme and drug between linesterol and ergosterol. Fungi CYP450OR14A sterol demethylase imidazoles triazoles, fluconazole and voriconazole. Drug that inhibit ergosterol and ER. Allylamines benzylamines imidazoles triazoles. Drugs that inhibit cell wall. Aconitandins. Drugs that inhibit plasma protein. Polyenes AMPB causes hole and leaks, binds to sterol lipid bilayer fungal membrane stability. Drugs that inhibit DNA synthesis. Flucytosine. Drugs that inhibit mitotic spindle. Grisevalvin. Flucytosine. Mimic structure replaces H with F, enters fungal cell wall via transmembrane cytosine permease. Fluconazole. Most antifungal used BTH oral and 4 inhibit 14A sterol demitase, also known as fungal P450. Parasite. Use host to benefit macroparasites, organism with life stages, protozoas and helminths, macroparasites, viruses and bacteria, X leeches. Malaria. Protozoan Plasmodium life cycles, sporozoites, mosquito bite, merozoites, parasite travels bloodstream to liver and reproduce, gametocytes leave liver to RBC, reproduce, parasites burst and infect RBC. Anti-malaria drugs. 1. Parasite asymptomatic in liver, hepatic stage 2 invade RBC and cause fever, erythrocytic stage drugs causal, suppressive, clinical, radical, long-term. Casual prophylaxis. Promethazine proganol. Suppressive prophylaxis. Proganol, quinine, chloroquine, pyrimethamine, artemisinin, tetracycline. Clinical cure. Quinine, chloroquine, proganol, pyrimethamine, artemisinin, tetracycline, mefloquine, sulfonamides. Which anti-malaria is fast-acting? Artemisinin, free radical by iron alkylation of heme and proteins. Negrited tropical disease NTD. Onchocerciasis or river blindness. Drug for onchocercivolvulus node form adult worms only against microfilariae. Ivermectin. River blindness treatment. Biannual ivermectin or mectizin. Mectizin MOA. Paralyze and kill parasites by binding to chloride channels. Glutamate-gated relaxes muscle cell and nerve cell. Amoebiasis grow in brain drug. Metronidazole 10-day dose. Toxoplasmosis. Leading cause of death due to foodborne pregnant women. Severe consequences: neglected parasitic infections. Toxoplasmosis drugs. Pyrimethamine, folic acid antagonist, daradamomesulfadizine. Schistosomiasis. Also known as bilharzia, freshwater snail's skin come in contact with infected water. Schistosomiasis drug. Praziquantel single dose. Vaccine for parasite? No. Life cycle and tissue structure complexity, complicated structure of multiple organs. Major problem with malaria drug? Drug resistance. Virus. Single nucleic acid need host cell to survive electron microscope and X-ray. 12. Historically terrific virus. Ebola, Marburg, hantavirus, Lassa, rabies, smallpox, dengue, influenza, SARS, MERS, Zika, COVID-19. Which virus goes with its receptors? ICM. Polio. Which virus goes with its receptors? CD4. HIV. Which virus goes with its receptors? Acetylcholine. Rabies. Which virus goes with its receptors? EGF. Vaccinia. Which virus goes with its receptors? CR2 per Candela 21. Epstein-Barr. Which virus goes with its receptors? HVEM. Herpes. Which virus goes with its receptors? Sialic acid. Influenza Rio Corona. Which virus goes with its receptors? ACE2. SARS-CoV-19. Respiratory. Flu A, measles, SARS-CoV-19. Fecal oral. Polio, Hep A. Bloodborne. Hep B, HCV. Sequel. HIV, Hep B and C. Animal, insect. Rabies, SARS-CoV-19. Result of viral infection. Destroy cells, changes gene expression, damage immune system. Immune system. Maintain balance and guards body. 1 innate, inherited 2 acquired. T cell initiate, B cell differentiate into plasma cell, produce antibody, BCLL greater than plasma greater than antibody. T helper cells, CD4 macrophages. Cytotoxic cells, CD8 killer T cells. AHRDER to develop agents against bacteria or virus. Virus, they co-opt the host cell metabolic machinery. All virus encode proteins substantial different from human. Antiviral 4 steps. 1. Attachment/entry receptor block receptor 2. Nucleic acid replication 3. Virus protein processing make functional protein to target 4. Virus maturation. Attachment and entry drugs. Maraviroc and enfivirtide. Viral uncoating inhibitor. Adamantanes. Protease inhibitors. Viral maturations. Neuraminidase inhibitors. Viral release. Viruses associated with human tumor. Epstein-Barr, Burkitt lymphoma, HPV, warts, cervical carcinoma, HTLV-1 leukemia, Hep B and C, liver carcinoma. HIV. Retrovirus causes AIDS type 1. 4 major strains. Major M. Most HIC virus outlead ONU NP type 2 through body fluids, mostly in Africa. Anti-HIV drugs. NRTI zotavudine, ezalcitabine, estavidine, lemifidine, NNRTI delavirtine, nevirapine, efavirins, PI ritonavir, nelfinavir, saquinavir, indinavir, imprenavir, heart 1 PI, 1 NNRTI or 2 NRTI. Heart, highly active antiretroviral therapy. Heart 1 PI, 1 NNRTI or 2 NRTI. Best treatment for HIV/AIDS co-infection is the killer, not the infection protease inhibitor. Hepatitis A have self-cure, contact, food, water, blood expose. HBV. Chronic persistent hepatitis, cirrhosis, liver, hepatocellular carcinoma, sexual, parenteral 4, perinatal pregnant, TX, interferon, lamivudine. HCV. Lower HBV manifestations, transfusions, 4, sex, birth, 100% treatment, TX, interferon, ribavirin and ribavirin together better than alone. Influenza A. RNA genome virus respiratory spread secondary bacterial infections TX, amantadine and rimantadine celiac acid, zanamivir, oseltamivir. Smallpox. Blind and disfigured eradication. Poliovirus. RNA genome GI illness and poliomyelitis Salk killed inactivated vaccine Sabin live attenuated vaccine. Measles. RNA virus single-stranded airborne virus vaccination. Interferon. Protein produced by immune system glycoprotein equals cytokines action inhibit viral replications activate T killer cells and macrophages increase antigen to lymphocytes resistance to host cell against virus. Problems with antivirals. ID-specific virus target resistance. Antiviral for HIV and not Ebola. Ebola single-stranded non-infective RNA genomes produces and replicated large amounts of virus. COVID. Single-stranded possessive sense RNA short replication time as protein viral attachment develops antibodies ACE2 receptor COVID tissue destruction. COVID treatments. Non-specific recombinant IFN with ribavirin only limited effects plasma and antibodies drugs remdesivir and chloroquine blocked virus infection remblock infection and replication chloroblok virus infectio widely distributed in whole body and lung. Ivermectin in COVID. Prevents viral entry action on viral replication and assembly and interferon INF levels. COVID vaccine. Lipid mRNA particle the more inject the more tissue damage mRNA modified more resistance to enzyme. Iron deficiency and